Hello everybody, this is Dr. Don Clum with drclum.com and yourvirtualdoc.com. Today I'm at Abundant Health here in Long Island, New York, our brick and mortar practice, to go over just a little bit about Lyme disease. You've either come across this video on our website or YouTube, or maybe you found it embedded in one of our articles on Lyme disease. But Lyme disease has got to be one of the most misunderstood health issues and diseases out there. Almost everything we know about it is either wrong or very misleading. First has to do with how you get it. Everyone knows about the tick and the bullseye rash, do you not? That is the diagnosis in medical offices when someone is suspected of having Lyme disease, or a patient says, "Doc, I think I might have Lyme disease." What are the first questions? Have you been bitten by a tick recently? Have you ever had a rash or bullseye rash around any insect bites, right? If not, it's totally disregarded, discredited, you move on to something else. That is absolutely the wrong thing to do. Right now, here in the Northeast alone, 22% of the tested bugs that bite or sting can carry Lyme disease. There's new studies coming out showing that birds can carry Lyme disease. That Lyme disease can be communicated between person to person. You can pass it on person to person. So the idea that only this one deer tick and this rash-producing bite can cause Lyme disease has got to be thrown out the window, and that question can be asked, but it should not be relied upon for a diagnosis. Number two is the blood test. Here's what happens. If they suspect it, and maybe there's some reasons that they do, and they send you off for the blood test to see if you have Lyme disease, it can test your blood for the bacteria, and it can let you know if you have an acute Lyme issue, but it cannot rule out if you don't. That's a very important distinction. It can tell you if it's going on right now, but it can't tell you if the condition and health problem you have isn't Lyme disease. So it's got a lot of false positives, very misleading, and it's very hard to interpret a test that can sway that much. So I don't even use it in our practice. And number three is the treatment. I think that due to the nature of this particular bacteria, it's called a spirochete. It's actually got a spiral shape to it, and that changes how it moves and how it moves within your body fluids, your tissue cells, and things like that. Due to the nature of this bacteria, the common treatment for Lyme disease, or when suspected of Lyme disease, is antibiotics and usually some kind of fever suppressant or painkiller like Tylenol. These are, in my opinion, the wrong moves to make. One is because of the nature of this spirochete, it's like a corkscrew digging into your cells. It hides very well, and it gets very deep within your cells to a point where the antibiotics won't affect it. It also creates antibodies of itself that it separates and puts outside the cell as a distractor, as a deterrent for your immune system, so that it doesn't get picked up on the radar of your immune system. Now, the second part of that is Tylenol. Tylenol is used because of the fever, because of the associated symptoms that comes on with an infection like this. Tylenol will actually affect and could shut down your glutathione pathway in your cells. What is your glutathione pathway? That is the pathway that makes the most powerful antioxidants in your body that not only fight off infections such as Lyme's, but fight off cancer, fight off DNA mutations, fight off mitochondrial suppression. What does this mean? Big time diseases are fought off with this antioxidant. Your cellular and life energy is protected by this antioxidant, and it can be up to 200,000 times more powerful than vitamin E or vitamin C, this little antioxidant that you could be shutting down by using Tylenol. So, first we have the way we get Lyme's. It's all off, traditionally speaking. Two is how we confirm the test with the blood test, very unreliable. Three is the common treatment. And the reason that the antibiotics and Tylenol are so common is because Lyme starts like any other cold, flu, or general not so well type of condition. You get a fever, you get a headache, you get some body aches, you can have some congestion. It's just like many other different kinds of diseases and disorders that we can start with. So it can be very confusing. And it is that confusion that allows the infection of Lyme disease to smolder under the radar of the immune system, to withstand treatment after treatment of antibiotics and painkillers and Tylenol and things like that for years and years and years. Lyme's has another little characteristic that it co-inhabits with other infections. What does that mean? Is that it promotes and it thrives when there's other infections going on. It's a very common class classification of Lyme's is to have these co-infections. So it, not only does it keep your immune system low, not only is it a chronic thing that can affect you and your health, but it also lays way to other infections to kick in, other issues, other health concerns to kick in. So this is a nasty little condition. And so we at Abundant Health with the Virtual Doctor program, we have a completely different way to approach it. So when we approach Lyme's, it's important to get a very good history. It's important to take a lot of information in consideration with this. And it's very important to think out of the box, because right now the standards for medical care are unacceptable when dealing with Lyme's. So when we do, we take it from a long-term, natural approach, boosting the immune system, getting in on a cellular level, upping that glutathione pathway to help the body heal itself, get rid of this thing once and for all. And to say that it's easy would be untrue. It's not easy. It takes time, it takes effort, but it can be done, and it cannot be done through traditional medical approaches. It cannot be done with the way we're handling most of the Lyme, so it does take some distinct effort. Check out our other programs, check out our other information, articles, and videos on our website. Like us on Facebook, join our newsletter, all those fun things, and keep up with us. Join our community. We'd love to have you. Send us a comment, send us a question, and know we're always here for you. Thank you very much.